My dog Jackson was diagnosed with bladder cancer back at the end of May, and I brought him to our vet, my vet here at Sunshine Animal, Dr. Barry.
Transitional cell carcinoma is a serious type of cancer because it's very invasive in the urinary tract, and it can spread to the lymph nodes as well. We had Jackson on an anti-inflammatory drug that's used for treating transitional cell carcinoma, and he couldn't tolerate that drug. In fact, we couldn't even give him half the normal dose without him getting sick. There is no traditional chemotherapy available that's successful for treating the transitional carcinoma. So we were looking for something new that we might be able to help him with. This is a very interesting instance where the owner of the dog introduced me to the people that could actually help the dog. I'm very open to new therapies for cancer because just like in human medicine, chemotherapy is tough on dogs. The new treatments for the future hopefully will be no chemo and using the body's immune system to adapt it to kill cancer. The scientists at Morphogenesis took care of everything. They grew the cancer cells out at the lab, and they adapt those cells so that the dog's immune system can fight that off. Jackson's doing phenomenal. He has no clinical signs, no discomfort, normal urination. He has a normal urinalysis. Currently, our thoughts are that we would like to pursue this type of therapy in animals, which can also lead, hopefully in the future, to being able to help human cancer patients. I've been lucky to have Jackson as a patient. He's a real friendly, nice dog, and he's very gregarious. He's a happy dog. He doesn't act 10 years old. He acts like a 2-year-old. You know, I've really never experienced anything like this before. We have seen no side effects, and we're interested to see what happens in the future.
He's been doing just great. He has an incredible amount of energy. There's no symptoms. We've changed his diet, so he eats all homemade food that I make, fresh vegetables and lean meats, and takes vitamins. We've kind of just changed his lifestyle with the treatment, and today I have to say he has more energy than I've seen him have in a couple of years. He's going to be 10 in December, and I think it's a great success story.
When they bought him, and the owners bought him, he had melanoma. It had been surgically removed, a spot from his neck, a spot from his tail, and one on the tip of his penis that caused him difficulty in urinating. And he was diagnosed at that time with melanoma. The melanoma started spreading. They started becoming more proliferative along his body, in his mane, on his tail, under his tail, around his anus. And they started about 2 years ago, maybe 3 years ago, becoming so large that the owners asked if we could do anything else for that. We tried several herbal preparations the owners had found. We said that'd be fine, that not a problem. We tried some medications that quite often help reduce the size of melanomas, and they seemed to work well. But then Benny's melanoma started opening, oozing. The ones on his skin just started, seemed to be a problem with him. They would get infected. They were spreading, and the owners asked if we could do anything. Through morphogenesis, they came up with this wonderful experimental process. Benny was somewhat our guinea pig, but the owners said, you know, do you think it'll hurt? I didn't think it would hurt anything, and I thought that it definitely had a potential to be of benefit, and I'm so happy that it has been. His overall attitude seemed to improve. He had a problem with one of them in his rectum that was causing difficulty defecating, where he got a little bit constipated, and I'm happy to say that that one has regressed in size, externalized. He is by no means free of melanomas, but I would say the melanomas overall, the ones injected and even the ones on his body that were not injected, have shrunk in size by at least a third. They've changed in texture. They're getting soft instead of hard and firm and growing and being plump. They're getting flatter and softer, and I think that all that has been a positive change.
Seems to be highly successful in Benny's case, and so we're pleased. He seems to be doing a lot better. He really was, about 8 months ago on death's door, we were sort of wondering what we would do with him. And he's come a long way. He's getting much better, more normal. So he's, you know, we're optimistic that it will work out well.
It is a new process, as I think it's a new process for all of us, and I think that, you know, we all hope that there's going to be an answer to cancer, because it's such a nasty disease. And if we have every single cancer seems to respond differently to different, you know, whether they be chemotherapies or radiation or surgical treatments or anything else, if this is something that can work for melanomas and other cancers, I mean, my hope is for all of us, human as well as animal.